How many of you have never heard of the Adverse Childhood Experiences Survey? It's about a third of the room. How many of you, the ones that you've heard of the Adverse Childhood Experiences Survey, how many of you would say that you get it, you know it, you live in it, you breathe in it, you feel like it's impacted your practice on a day-to-day basis? That's a small percentage of the room. Okay, this is not unusual. This data, this science, this research is cutting-edge, groundbreaking stuff from 1995. Think about where you were in 1995. I have staff that had just been born in 1995, which is shocking to me. I was doing some data entry work yesterday in a statewide system that we have to use, and I have to input people's dates of birth for identity verification. It's a cloud-based EMR. I have a staff that I just hired who was born in 1995, and that was upsetting on a couple of different levels. Because I know exactly where I was in 1995. So the science we're talking about is not brand new, and yet, no matter where I go across the United States and Canada, this is kind of how it shakes out. About a third of the room has heard it, sort of knows what's going on. About a third of the room feels like they're in it, and about a third of the room has never heard of it before. And lately, the conversations I've been having have been with physicians, surgeons, emergency room doctors. I've been doing a lot of medical grand rounds, and the proportion of individuals in those rooms that know about this stuff is actually less than in here. So we've got a lot of work left to do, 20 years behind us, but really all the heavy lifting is in front of us, and so I'm pleased to be here today talking to you about it. I'm going to give you a crash course in 20 years of neuroscience and child welfare. But it starts with Dr. Robert Anda and Dr. Vincent Folletti. Dr. Robert Anda was the lead researcher on the original CDC study. He worked for the Center for Disease Control. How many of you are familiar with CDC and what they do? Not far from here, right? We're in Florida. Usually when I have this conversation, I'm up in the Northeast. Atlanta's a far, far, far away. So Dr. Anda at that point worked with the CDC, Center for Disease Control. If you're familiar with their work, they work with diseases that kill lots of people. Ebola, Zika, bubonic plague. Yes, they're still researching bubonic plague. In 1995, they started looking at trauma, which is really, really interesting from a public health perspective. Really interesting. That trauma, 20 years ago, began to rate with bubonic plague, Zika, and Ebola, and started getting federal attention at the CDC. Dr. Vincent Folletti was a physician who worked with Kaiser Permanente, a large commercial health insurance corporation, mostly on the West Coast. The two of them partnered, and they were really asking questions about what was impacting their adult patients' health and well-being, mostly obesity. They were wondering why they couldn't be more effective with a large population of obese individuals that were experiencing all the medical consequences that are secondary to obesity. And they designed a study to take a look at the retrospective experiences of this group. And now it's important to know as we go through this that the group they looked at was a group of Americans, largely on the West Coast, largely middle class, largely Caucasian, mostly employed, educated, with means and access to preventive medical care. Okay, so keep that in mind. This population is probably not representative of the individuals, the children, the families that we all work with on a day-to-day basis. And I didn't get a straw poll of who's in the room, but it's my understanding that we've got a really good cross-section of social workers, mental health providers, community nurses, school administrators, law enforcement, judges, probation, police. Who've I missed? Who's in the room that I haven't? Educators. Who else? Guardian ad litem, great, we need you here. Who else? I'm sorry? Attorneys, wonderful. Okay, all right. This is a great cross-section, and I really actually prefer speaking to groups that are not homogeneous. When I get a room full of social workers, they make me feel really good because they nod at everything I say, but I'm preaching to the choir. This information really has to move across sectors, and I think you'll see that for those of you who are going to be here through the screening of resilience, you'll see why that is. And so what Kaiser and the CDC did back in 1995 is they took that sample of 17,000 individuals and they asked them a series of 10 questions. 10 questions. And I know this is impossible to read if you're anywhere not on the stage with me. But so you don't need to worry about the 10 questions, but just kind of quick show of hands, how many people have seen the ACEs survey? Okay, so many of you, most of you have seen it, so you're at least somewhat familiar with the 10 questions. I'm not going to go through all of these, but what they do touch on is exposure to emotional abuse, physical abuse, verbal abuse, sexual abuse, neglect, abandonment. which sadly is not the full range of human suffering, and sadly is not the full range of the potential adverse childhood experiences that our children are facing on a day-to-day basis, particularly in urban environments. But this snapshot in the context of a pretty affluent, educated population of individuals with means and access to care, these results are stunning, and then if we start extrapolating that into the populations that we work with, it becomes even more profound. So just really quickly, think about the questions, and I'm just going to read a couple of these, but think about what percentage of the individuals, the children and or adults that you work with on a day-to-day basis, would or should say yes to this question. Number one, did a parent or other adult in the household often, very often, swear at you, insult you, put you down, or humiliate you? What percentage of the individuals we work with would say yes to that question, or should say yes to that question? Anyone? Right here, just call it out. Should. Should, well, oh, thank you, yes. Should, we hope none. In reality, how many probably will? All of them, 100%? 40%? 60%? 75, a good chunk, yes? So a vast majority, except for the 40%, the vast majority of the individuals we're working with probably will say yes to that. How about number two? Did a parent or other adult in the household often, very often, push, grab, slap, or throw something at you? How many of our people say yes to that? 45%. A lot, 45%. A majority again, right, of the numbers I'm hearing, right? Half or better, right? Or worse, probably, I should say. I'm going to skip to number 5. Did you often, very often feel that you didn't have enough to eat, had to wear dirty clothes, and had no one to protect you? How many of our kids and adults would say yes to that prior to their 18th birthday, by the way? 65%, still a majority. That's a score of 3 out of 10, okay? This is where the science starts to kick in. At 3 or 4 yeses prior to the age of 18 is where they started finding the most startling results in this population of individuals. And what we found, and this goes back to what Shaniek shared with you in her intro, is that ACEs, adverse childhood experiences, are not in and of themselves uncommon. We experience bad things in life. We experience some of those bad things in life before we turn 18. And that in and of itself is not a problem. Where it becomes a problem is where we experience them again and again and again and again, either multiple types of adversity or chronic exposure to a couple. And those are the kids and families that we tend to work with. In addition to that, the lack of access to resources, preventive structures, and options to improve their health, promote wellness and resilience, which I'll talk to at the back half of this, talk about at the back half of this conversation. We'll get there, but just kind of keep that in mind as we go. What Anda and Folletti found 20 years ago is that individuals with 3, 4, or more ACEs had significantly higher rates of a variety of long-term medical and mental health consequences. In fact, they found a relationship, a very strong relationship between ACEs and just about every medical problem that we worry about and face today. Obesity, diabetes, heart disease, chronic obstructive pulmonary disease, mental health, suicide, IV drug use, early death. Individuals with ACE scores of 6 or more on a large public health scale, individuals with ACEs of 6 or more, on average die 20 years younger than individuals with lower ACE scores. And again, these were the results of the 17,000 individuals on the West Coast with insurance, money, education, family, and resources. Think about what this means for individuals who don't have those strengths and opportunities. The impact is amplified. Dr. Melissa Merrick is the current lead researcher at the CDC in charge of the ongoing ACEs research. And they've started this work 20 years ago under Anda's leadership. Anda has since left. He travels the country doing presentations much like this. I had the opportunity and the pleasure of meeting Dr. Anda a couple of years ago. I met Melissa Merrick last year. She's incredible and brilliant, and she gives really good hugs. I encourage you to get in a room with Dr. Merrick. She will blow your mind and give you a great big hug. Dr. Merrick is responsible for the ongoing research at the CDC for ACEs. She shared with us when she was in town at our annual symposium that of all the interesting and fascinating and frightening information you can find at the CDC website, the most hits, the greatest amount of traffic is at the ACEs section of the CDC website. And 20 years in, they are still getting the least amount of funding of any other CDC project, despite the profound public health implications. which to me, regardless of, and I'll be careful with this, I know I'm in a red state, but I'm probably in a blue room. I'm from a blue state, and I typically hang in blue rooms, but we're having a national conversation about health care. Think about how this information should be a part of that conversation, and yet all the coverage I've seen, not once have they referenced a 20-year-old study that has profound implications for large-scale national public health outcomes. We are not talking about trauma, community violence, community safety as an integrated component of public health and well-being related to the health insurance debate. That's my soapbox moment. I'll move on from that. So the CDC talks about the sort of domino effect of adverse childhood experiences, and they start with this graphic. This I pulled right from the CDC, and what you see here is a pyramid. Adverse childhood experiences on the bottom, sort of base of the pyramid. As we go forward, that's through the lifespan. And what you notice over here on the left-hand side is it starts at conception. The impact of ACEs begins to have an effect on us at conception. Not in adolescence, not in childhood, not when we're toddlers, not when we're infants. As soon as we're conceived, we start to feel the potential downstream long-term impact of adversity, and I'll come back to that in a moment. But so if we have a child who's exposed to a high number of ACEs, that will lead to disrupted neurodevelopment. I'm going to drill into that a little bit deeper, but to use some shorthand, that's brain damage. And so that disrupted neurodevelopment will lead to social, emotional, and cognitive impairment. That's where the social workers get involved, right? Whether you're a school social worker or community-based mental health, we get involved and we work with folks at the level of social, emotional, and cognitive impairment because they've adopted risky behaviors, which is why the law guardians and judges and police officers get involved. And so they do something in the community that is harmful to themselves or somebody else. That's the risky behavior. They get pulled into juvenile justice, bounced into a social worker's office, and so we, as a system, straddle the adoption of health risk behaviors and social, emotional, cognitive impairment. If we let that trajectory continue to play out, disease, disability, and social problems plague us as a society, and ultimately early death. And like I said before, individuals with elevated ACE scores tend to live on average less than individuals with lower ACE scores, and this is the relationship. And so I mentioned before that conception is where this starts. Imagine for a moment, imagine for a moment in a developing child in mom's womb, and imagine that mom in an abusive relationship, and imagine that mom experiencing violence, verbal abuse, physical abuse on a daily basis. What happens when we are threatened physically? What happens to our bodies biochemically? Anyone know? We get stressed, right? And so our bodies respond to stress by dumping stress hormones, adrenaline and cortisol. I'll come back to this in a few slides. But we dump adrenaline and cortisol, which are stress hormones that are designed really to keep us safe. But when we start flooding our bodies with stress hormones, it begins to have a negative impact on our bodies. When we have a child in that womb, in that mom who's in an abusive, stressful, damaging, toxic relationship, her body becomes toxic as it's flooded with stress hormones. Those stress hormones wash over her body and her brain, but they also wash over what? The developing baby, and the developing baby's body and the developing baby's brain. And so the impact of ACEs can begin at conception, and in fact, children, we know, in utero can hear, and they are already beginning to get tuned into the sounds of their caregivers and the environment. And so if that child is getting washed with stress hormones like adrenaline and cortisol while hearing mom and dad or mom and mom scream at each other and yell, the baby is beginning to connect stress, fear, toxicity, and the voices of their caregivers that really ought to be soothing and nurturing. And so already we're beginning to see the body and the brain begin to gear up for adversity once that child comes to term and is born. And so this is how the chain begins at conception. Let's kind of scale it up a little bit and talk about some national samples. I'm going to cruise through this pretty quickly. And so I want to talk about Jane Stevens. If anyone's not familiar with Jane Stevens, I encourage you to check out her work. She is a journalist and has been writing a blog, ACEs Too High, for several years, and she's been tracking national movements around how communities are adopting the ACEs information to impact schools, mental health, law enforcement, juvenile justice systems, a variety of different stories of impact on policy and practice. In fact, you've got a national site in Tarpon Springs, which I don't know how far. How far is Tarpon Springs from here? 3 or 4 hours. Tarpon Springs is actually part of a large national and international group of a select communities that are using ACEs to impact their community policy around law enforcement, public health, and juvenile justice, child welfare, and medical intervention. So you probably want to get connected with folks in Tarpon Springs. They're doing some really good work over there. So Jane Stevens has been looking at ACEs and what's been going on nationally for quite some time. This is a sample survey that she put up on her website. The good news here is that this sample of school-aged children, ages birth to 17 years old, the good news here is half of these children approximately had 0 ACEs reported. That's good. So that's the green light. The yellow light here is that the other 50% had 1 or 2. Again, that's okay. ACEs in and of themselves are not uncommon. We get worried once we hit 3, 4, and start climbing from there. And what I didn't mention before is back to Melissa Merrick's, Dr. Merrick's graph here. I think this is well designed because it shows the dose-related response or dose-related relationship between ACEs and long-term health consequences. So you see the staircase graph over on the right-hand side. More ACEs means more risk, means more health problems. And so as you climb and rack up more ACEs before your 18th birthday, you are at greater risk of a variety of long-term health consequences. How many of you are in public schools or special education settings? It's about a third of the room. This is a snapshot from Walla Walla, Washington. How many of you are familiar with the film Paper Tigers? Great. For those of you who haven't seen it, go see it. Paper Tigers is a fantastic film. It's actually film number 1 of the series that you're going to see today. Resilience is number 2, done by the same documentary crew. And they went into Lincoln High School in Walla Walla, Washington, and tracked what happened over time when the faculty and administrators got trauma-informed and started using ACEs in the classroom to talk about behavior and academic performance. So Walla Walla, Washington has been doing some great stuff around ACEs in the classroom, and so when they look into a classroom, they see 25, 30 kids in the room with 13 of them with 3 or more ACEs. We're going to talk a little bit as I get going about the relationship between ACEs and mental health and emotional disturbances and behavior problems which pop up as social emotional problems in the school, and we get tagged with things like emotionally disturbed and IEPs and things like that, and we can also connect it to the school to prison pipeline when schools don't interact in a trauma-informed way. I also want to show you this, this graph. This is a snapshot of children that touched the child welfare system, not necessarily removals, but it might have been a child protective investigation that went to no finding. It might have been a child who was placed into preventive services. It might have been a child who was placed into kinship care, foster care, therapeutic foster care, or right on up to residential or even detention. And those are the kids in red, okay, versus the original CDC sample, the 17,000 individuals that I mentioned at slide 1 or 2. And so what you notice here is that the kids in child welfare have significantly greater exposure to adversity, which again is no shock to anyone in this room. But if you look at these numbers and the exposure compared to that original 17,000 sample from the CDC study in 1995, we've got the kids in child welfare in red, with about 51% of this sample having ACEs 4 or more. And this sample, by the way, is from ages 2 months to 17 and a half years old. Versus the original CDC sample, only 13% of those individuals surveyed were found to have ACE scores of 4 or more, and still, they were highly predictive. In fact, an ACE score, an elevated ACE score, is a better, stronger, more reliable predictor of heart disease than high blood pressure, high cholesterol, and smoking. Wow. I have high cholesterol. I'm supposed to start a statin. My doctor has been on me for 3 or 4 years about the high cholesterol that I have. So he talks about the risk factors. I no longer smoke, so I can take that one off the list. But I also have a pretty strong family history of heart attacks. My father's had 2. My grandfather died of 1 early. So I've got a lot of predictors for heart attacks. Guess how many times my doctor has asked me about my ACE score? 0. I'll be educating him soon. How many of you work in juvenile justice? A few? Washington also looking at their populations of incarcerated, remanded, and detained youth. Anyone familiar with the Richard Ross photo essay of juvenile justice? Some pretty inhuman pictures of how we're treating our young people in detention settings. I'm from a blue state in New York, and right now we are doing battle over raise the age. We currently have a waiver age of 16, so we treat 16-year-olds like adults and they go into the criminal